That's I'm trying to explain some factors that you see under modifiable factors. Now, going to non-modifiable factors, you have alcohol intake, you have overweight or obesity, you have physical inactivity, especially menopausal women. That's women that have stopped menstruating. You have people that don't have children, aside, like, for example, the Reverend Sisters, or people that just intentionally do not want to have children. They are more predisposed to having breast cancers. You also have the menopausal hormonal therapy. There are people that during menopause they have a lot of signs and symptoms that when they go to hospitals and expect or explain to their doctors, and what happens is their doctors recommend hormones, drugs that would help them to manage those signs and symptoms. So you have that, and most of these things have the hormones, that's estrogen and progesterone. So people that are on hormonal therapy for menopause also are predisposed to having breast cancers. You also have people that take birth control pills, that's the contraceptives and the rest of them. Not just birth control pills, you have the insertables and the rest of them. People that take these things, people that have take are exposed to the injectables, contraception in general, are of higher risk of breast cancers. You also have people that have breast implants. I mean, that one is self-explanatory. So, breast implants, you have implantations of various things in your breast. What happens is you start destructing the normal function and structure of your breast. It tends to trigger, and it can trigger anything in your breast. So once the growth factors that are responsible for multiplication of these cells are active, what happens? Your RB, for example, one of the growth factors are cancer cells. You have your retinoblastoma and your E6, your E7. So once all those things are activated, your breast starts, you start having the breast cells multiplying and the rest of them. So these are the common risk factors. Just like I said earlier, there is no primary cause for breast cancer. You cannot say, oh, this is what causes breast cancer. And lest I forget, you also have the very important one, which is genetics, and it means that you can inherit it. So you have a parent that has breast cancer, it means that any of the child is predisposed to having breast cancer as well. You understand? So aside this, aside saying that there is no cause, there are predisposing factors, there are risk factors that can expose you to having cancers, which I just mentioned. And I said alcohol intake, overweight or obesity, you have physical inactivity, you have not being able to bear children or not having children intentionally, you have not breastfeeding, birth control pills, breast implants, and the rest of them. So we'll move along to how does this breast cancer spread? How does it spread? How does it move from where it's exit from its origin to wherever you are going to be seeing it? So primarily now, whenever we hear of cancers, otherwise known as carcinomas, what should come to our mind is that it's going through the lymphatic system. Now, what do I mean by lymphatic system? Lymphatic system is a part of the system of the body that takes care of immunity, what helps us to fight infection, curb infections, and the rest of them. So, whenever you hear of cancer or carcinoma, it is spread through the lymphatic system. For instance, uh, one of the signs of breast cancer is engorgement of the breast. I know we are well aware of what an orange looks like. You see the back of an orange, it looks swollen and more like there are dimples all over, right? Now, the reason why we have those dimplings all over the orange, just like in your breast, the reason we have those dimplings in our breast is because the cells that are multiplying or that are spreading have engorged the lymphatic system. You understand? Usually, the lymphatic system contains lymph fluid, right? And it also contains these ducts that allows for free movement of the fluid to and through the body. So what happens is once these cancer cells start multiplying, they block the flow of the lymph fluid. So let's take it that there is a pipe, right? There's a pipe, and we are on, and let's also take it that that pipe is elastic. So what happens is the pipe is struggling with the cancer cells as well as the fluid that is supposed to contain, right? So what would happen is as those cancer cells are filling the pipe, it starts to expand. And that expansion is what we see on our breast as engorgement. You find out that that person's breast, because the lymph duct is engorged or is filled up or is being obstructed by those cancer cells, it becomes engorged and you see it as a back of an orange, like a swollen nature and then more like a dimpling. aside back of an orange, you can also explain it as someone that has goosebumps. I know everybody has had goosebumps, so that's the way it looks. That's one of the signs and symptoms. But I know I'll get there shortly. So, so just like I said, once the spread gets to the lymphatics, the breast becomes engorged, giving the appearance of the back of an orange that we may commonly see. So I don't know. I have gone a little bit, maybe far. So I don't know if you people are understanding. To the best of my knowledge, I think I'm explaining it in lay terms, but I want to know if everyone is with me.
Okay, Val, from what you're saying, can we ask questions? Can we ask if anybody has questions? So we
Yes,
ask
please.
questions, answer, then you continue.
Yes, please.
Okay, please. If anybody has question, the person can unmute the mic and ask the question. So we answered some questions and we continue. Anybody with any question,
Hello,
please.
good evening, ma.
Hello there.
Okay,
Good
good
evening.
evening.
Okay. Concerning the signs of breast cancer, I had a friend of mine. Recently, she was telling me that she's feeling this pain beneath her breast, as in under.
Mm-hmm.
Actually, she just feeling the pain, but there's no sign of swelling, no sign of maybe something on her, this thing, armpits. There is no sign, but she just feeling this pain beneath the breast.
Mm-hmm.
What could that mean?
Oh, okay. First off, is I've not actually gotten to signs and symptoms of breast cancer, and I'm supposed to talk about that as well as breast self-examination. So I think we'll leave this question to when we get to that point. And when I get to that point, you don't still get it, maybe we can refer back. Is that okay?
Okay, ma. Thank you.
Okay, any other person with question, please unmute your mic and ask so we continue. Any other question? So that means you can go ahead.
All right, thank you very much.
Oh,
Okay,
thank you.
so I think the last thing we talked about is the spread. We'll move along to signs and symptoms of breast cancer. Now, we have various signs and symptoms generally of cancer, but then specifically for the breast, okay, like it's being presented. Alfred, please, can you zoom this? Can you zoom in a little? Okay, we'll start with the first. So we'll just go through. When we get to the next, to the ones below, you can just zoom up. So for the breast, first off is commonly we should know that a very first sign of breast cancer is the lump in the breast. Is either in the breast or under the arm, right? And I would like to correct the impression that breast is not just what you see, like just around your chest. The breast extends to the under the arm, and that's called the axilla, the axillary part or axillary tail of the breast. So while we'll still talk about breast self-examination, whenever you're doing anything that concerns your breast, just know that your breast extends to under your arm, right? So just like I said earlier, one first sign of or one of the signs of breast cancer is a lump in the breast. And how do you depict that? By breast self-examination. So when you conduct breast self-examination, you understand or you find a lump, an unusual thickening in your breast. It tells you, okay, I should see my doctor and conduct more tests and know what is going on, right? So for everybody that has breast cancer, you find out that there are numerous lumps. It's not just one. Now, I told you earlier that breast lumps are usually benign, right? But when it becomes cancerous, it's more like they multiply sporadically. So for breast cancer, you have numerous lumps all over the breast. For someone, just like one of the patients I had some years ago, when you lift the breast, it feels like that it feels like you have 100 stones in the breast, like they are just moving everywhere. So that's how it feels. And then what I'm trying to say is that for every breast that is cancerous, you have a lot of lumps. It's not just one. You understand? And as it proceeds, as you go from stage 0 to, we'll talk about stages as well. As you go from one stage to another, the lumps increase. So aside the lumps, you also have thickening and swelling of the part of the breast. I think I've explained that with that dimpling. You have your breast becomes thickened. It's no longer the same size like you used to have before, and it becomes swollen because they are, let's say you are supposed to have 1,000 cells in your breast, but because those cells are multiplying sporadically, it means that you would have over 3,000. So you have a balloon that is smaller in size. As you add more air, it becomes larger. So just use that for your breast as well, as the cells are increasing.